Well, hi everybody, this is Dr. Schroeder with this week's video introduction to week number 5 in our course in evidence-based practice. And now that we are at week number 5, we're officially at the halfway point, so we're halfway through the course material. And in week number 4, we had a very good week discussion once again. The focus this week was on talking about a variety of things, but primarily we talked about control and validity and maintaining internal validity and overall rigor in a research study. And this is particularly important, especially when we're talking about quantitative studies. And that was really the focus of this week, is looking at the hospital staffing study, which was a very large study done quite some time ago, and is actually a study that has been very widely cited. The overall discussion was very good, and of course most of you identified that actually the controls that were put forth by the researchers seemed to be pretty tight, that the overall internal and external controls were very good. A good deal of discussion was taken up with the percentage of the respondents, and now, mind you, to give you an idea of the scope of this study study was done in the state of Pennsylvania, and 50% of the nurses in the state of Pennsylvania, or 50% of those at least that met the population criteria, it wasn't every nurse, but it was nurses working essentially in acute care areas, 50% of them were contacted, and about 52%, or just over half of those, responded. So that means close to 25% of the nurses in the state of Pennsylvania participated in this study, which is a very high response rate. Some of you had mentioned that seemed like it was really relatively low. And in the real world of studies, anytime that you can get over about 10 to 20% of your recruited subjects actually responding to a study, that's actually a really good number. Personally, I shared in the class, and this is a fairly a typical response, but in my doctoral study, I had to recruit 60 students to participate in a study. And when I thought, 60 students, no problem. I teach students, I know a lot of educators, I shouldn't have any problem, gathering up 60 students to complete a half-hour critical thinking skills test. I mean, it seems like it should be fairly easy. But I had to talk to hundreds of nurses to get 60 to participate. And I had to go to 3 different states and many different schools over 3 states to get people to actually log on to, to take my, to take this test. I ended up talking with hundreds. I think I had around 450 actually signed consents, but of those, I can only get about 60 to actually go on and actually complete the study. So, remember that it's not so much really the percentage of respondents to a study. It's really how many do you, have overall total. The more nurses that you have, or excuse me, the more subjects you have in a study that match your target population, the higher the validity and the higher the confidence levels of that particular study. And so that goes on really to this week's discussion, week number 5. Also in week number 4, we talked about the informed consent process. We'll talk about that a little bit later in the class also, but the informed consent process is really a very important part of the overall research process. One of the things that's a little bit misleading sometimes when you read these studies is you don't realize the amount of work and the amount of care that is taken to research subjects' confidentiality, their privacy. Many different mechanisms are put in place to essentially keep the information safe and to keep it out of hands where it is no longer anonymous and where possibly compromising information might be displayed. But it's usually not described in any great detail in the study. Oftentimes all you'll see in a study is that IRB procedures were maintained, and actually there's a rather invisible process behind every study that is that IRB process, that is usually a document that is somewhere between 10 and 60 pages explaining how the researchers plan on protecting their subjects throughout a study. It isn't usually discussed in great detail, but it is available for review by anybody that wants to review that material if they contact the researchers and or the sanctioning body for that particular research. Every research study that is peer-reviewed in the United States and actually in the world has to go through an IRB process. There has to be a formalized institutional review board. Every educational organization, every research and science foundation, and even many large corporations have an institutional review board. It's required for any kind of research where the research is going to be published or where any grant money is going to be given. And grants are something we really haven't talked about, but that's actually sort of the driving force between who pays for a lot of these different research studies. And so in week number 5, we're going to shift our focus a little bit and talk a little bit more about target population and sample sizing and how do we find a good sample for a study. It's important to realize that those two terms are not the same thing. The sample is the number of people that actually participate in our study. The target population is that population that sample is meant to represent. In other words, a target population is sort of a small representative sample of the study sample is a much smaller representation what a much larger target population is. And so the way that we figure out how large that population needs to be, there's various ways that we do that, and that's going to be the primary focus of discussion in this week's class. Of course, in week number 5, you also have your quantitative critique due. This is one that was actually introduced a little bit last week. The links are available both. I posted a link in an announcement, but I also found that the link is available. A link to the article is also available within the syllabus itself. So it is not in the e-reserves. I believe it is in the week 4 discussion or assignment description. It says it's in e-reserves, but actually it's available online. So there's a couple links that you can go ahead and get it if you haven't downloaded it already. And you should start on it because, again, this is something that is, it's easy to misjudge the length of time that it actually takes to do this study. You have the critique form. You only need to type into the critique form. You don't have to do any other paper. You don't have to worry about double spacing when you type into the little critique boxes. But for each criterion that you are assessing, you need to be complete and address how you found that particular criterion was met in the article. You need to and if something is not applicable or if you found that it was not available, how did you come to that determination? And so it is, in other words, none of these various critique criteria, none of them are going to be not applicable. If you find one that isn't applicable, you need to describe why it isn't applicable. How did you come to that determination? And remember, 25% of your grade is going to be this quantitative critique, and then the qualitative critique that you have in week number 7 will be another 25% of your grade. So doing well in these two assignments, these two critique assignments, goes a large way in increasing your grade score. Also, of course, in week number 4, you completed your midterm exam. Those have been automatically scored and have been included in the grade book. And if you have any questions about that, please go ahead and let me know. So once again, it's been a great week of discussion. I'm looking forward to another great week of discussion. Happy Memorial Day. I am taping this from my little temporary office, I guess you could say, here in Rosarito Beach, Mexico, of all places. I have my other home, and so right now my office is unavailable, and so I'm actually, here with you from my beach house. But I look forward to seeing you all in class. Look forward to participating and answering any questions as we go along, and I look forward to seeing you in the discussion forums.